Hello and welcome to our October webinar. I'm your host, Ian Craig, and I'm joined this evening by my close friend and colleague, Pete Williams.
Evening.
As athletes or advisors of athletes, if we wear our performance hat too tightly, we might get a bit blinded in our quest to consume enough calories, enough macros into our diet, which most likely will include some refined and processed foods. And things that come to mind easily are items like sports drinks, gels, bars, flavored protein, and recovery shakes, often with less than a perfect diet. Most athletes aren't going down the road to get Farmer Jim's carrots, but rather what's convenient. But what does that do for an athlete's teeth, their oral health, and very importantly, their long-term systemic health? So as a functional medicine practitioner, Pete's been digging into the subject over the past few years, and he's ready and waiting to share his wisdom with you. As Pete gets started, can I ask you to just familiarize yourself with the chat box, which we'll be using tonight, and tell us where you're from, what you do, and also what inspired you to join tonight. Also, while Pete's presenting, pop your questions into the chat box and I'll throw them over to him at the best opportune moments. He'll give some space for a Q&A at the end as well. Okay, Pete, over to you, mate.
Thank you, and good evening, everyone. So we're going to be talking about oral health, and I'm going to do this in two ways. Usually I present to people with regards to the association with oral health and systemic health. And I'm going to do quite a chunk of that tonight because I want to familiarize you with just basic from a point of view of oral problems and oral diseases and how they manifest in systemic disease development. Really what I want to try and do tonight is give you a sort of a view of just real, what I would consider preventative medicine for your athletes, because there are consequences to the things that we do much earlier on our life that may accelerate issues with regards to systemic health later on. And this is a really great example of trying to understand an area and understand the potential consequences to maybe what athletes are doing. Now, purely in the sports nutrition and sports medicine field, there's not a lot of this that's been uncovered yet, although there are papers. And really what we've got to be able to have is we've got to have real systems thinkers who are starting to say, hey, you know, maybe we need to think about athletes' oral health, both from a point of view of problems as athletes, but also problems from a point of view of the systemic world as we go forward. So I really want to frame this, and just let me get my, I really want to frame this with two papers. This is a 2015 paper on the left-hand side, and a recent paper from 2021. It's actually a dentistry journal. And I really want to concentrate on that one, because what I want to try and get you to think about today, and really get them in the chat boxes, is to think about situations where oral health maybe become problematic as an athlete. So you've got to start thinking about, well, what are the situations that, and maybe the mechanisms that as a sort of part of sort of athletes' needs for their event or their training, or actually in the event or the nutrition, where we may see detrimental aspects with regards to oral health. And really, particularly, I would say the paper on the right, which every paper that I present tonight is free access online. And so I think this is a really great paper from 2021. And it really is the sort of paper that I think actually has really good references off that you can go and look at. But I'm going to sort of, again, I want you to think about it, but what is it aspects of the diet that may alter various aspects of health in the mouth from a point of view of pH, from a point of view of buffering capacity, from a point of view of microbial dysbiosis, And these are things that we've got to think about. And where do they come from? You know, we've got to integrate them with regards to training regimes, training intensities, maybe climatic conditions that change the salivary flow rates. And so whilst I'm going through this, I want you to maybe think about noting some of this down, because obviously we'll have a Q&A at the end. And I really want to use this as an opportunity over the next half an hour to 40 minutes for you to think, well, what could put my athlete at more risk from dental health issues based on the sport they do and how that sport is? So have a think about that, and have a think about what those mechanisms may be. But one of the key things that I like from both of these papers, and what I want to propose to you as well, is that sports training and sports events may create an open window for oral cavity diseases. So diseases of the mouth. And again, what are the mechanisms that drive that? How does food affect it? How does the training intensity and duration affect that? How does maybe trauma and impact on the oral cavity cause an issue on that? Are we going to have any issues with regards to reduced immunoglobulins that we can talk about from training? And where does that leave the mouth? Does that leave the mouth open to problems? And I think what the evidence is showing is absolutely. And I think what the evidence is also showing us is that we may have a much more susceptible group from a point of view of athletes. And when you read the literature is showing us that many athletes are already showing oral disease. And that's going to be potentially problematic for the future. And so my way of processing this and thinking this is that I believe that we've got to be careful as practitioners that we're not just trying to get the best out of our athletes. We're trying to provide an athlete who is going to live a long and healthy life. So things to think about, we'll chat about later. Because in my world, with regards to just chronic disease and patients, and also people who are healthy and just trying to optimize their aging, we're already getting into the areas of testing for oral bacterial pathogens. And this is just a normal test that I would use for over a decade now. And so again, are there ways that I can look at athletes, or I can look at just general population and get an indication about who's on the battlefield of the mouth? And not only who's on the battlefield of the mouth, what are their pathogenicity? Now, again, as Ian's probably told you, I've got quite an expertise in this area, so much so that about 5 years ago, I developed a genetic panel for getting a deeper understanding with regards to gum disease called DNA Smile. It was a collaboration with myself and Nordic Labs and DNA Life. And the reason why I wanted to develop this is because the way we've got to think about gum disease, periodontal disease, we'll interchange those terms, periodontal disease and gum disease, essentially the same thing. But it seems to be a keystone disease for other diseases to develop. And that's quite a key feature, because the associations with the relationship between gum disease and other systemic diseases are quite profound. And obviously, having spent the last few years digging into the literature, that's why what I wanted to do is have a deeper understanding of how individuals develop or are at risk of developing periodontal disease. So my point about that, let's assume I get a young athlete who has poor genetics with regards to periodontal disease and a mouthful of pathogenic bacteria that is exaggerated by their athletic events. Then we may have an individual who is hyper susceptible to developing very early onset oral disease. And the problem with that is that that starts to make them much, much more susceptible to most of the chronic diseases that we try to treat. So that's why I think, as part and parcel of your role and your job, is to at least have some degree of understanding about what the mechanisms that may drive altered oral health from a point of view of the sport, from a point of view of the training, from a point of view of the diet, and make sure that your athletes are at least aware of this and aware of the associations of chronic disease as we go forward. So what I'm going to do is I'm going to give you a sort of little bit of a tour of presentations that I would usually use for clinicians, etc. And I want to give you that feel, because there's not a lot of papers who are actually suggesting at the moment, and I'd like to think I'm probably one of the first to suggest that you cannot ignore oral health with athletes. And let me show some of the data that is just really showing you how oral health and good or bad oral health may become a keystone mechanism for other diseases to develop. And I'm also going to very briefly go over the mechanisms that drive that. This is a really great paper, 2021. It is Immunological Reviews, just a really wonderful paper with regards to how gum disease creates or exaggerates other chronic diseases. It looks at basically how a disease of the mouth, a local disease, has very systemic effects, not only on these disease progressions, but on how it primes the immune system as well. Really wonderful paper again, but remember, every paper I present, free access online. This is just both brilliant from a point of view of a narrative perspective, but also from a diagrammatic perspective as well. And really, I want to show you how those manifest. And I'm going to use that from a point of view of choosing just Alzheimer's disease as an example. But the numbers, I'd just like to say, the numbers with regards to periodontal disease and all other chronic diseases are quite profound. And I'm going to give you some examples on that tonight. But I'm going to show you and just base this with regards to a lot of the research that I've done around Alzheimer's, but also, cognitive decline is something that we treat extensively in my practice. So I'm reasonably well up on it. And I've developed, certainly DNA Smile that I developed was not only developed for understanding oral disease, it has this sort of oral disease, cognitive decline, Alzheimer's feel to it as well, because I wanted to have it developed for that purpose as well. But my point about this is that local issues or local disease can have very systemic consequences. And so why does the mouth matter not only in your athletes, but in Alzheimer's risk? Again, let's assume we've got an athlete, and that athlete may have some susceptible genotypes. They may have genotypes of pro-inflammation. They may have genotypes like an ApoE4 and hopefully not an E4 genotype result, because immediately you may be putting your athlete at more and more risk based off poor oral health and some of the genetic data that we can get. I really want to bring you back to this paper. This is David Furman's paper. He is one of the primary researchers at the Buck Institute, which is just about an hour north of San Francisco. I had the pleasure of going there in 2015, 2016 to do the Bredesen protocol. Obviously, hopefully most of you know what the Bredesen protocol is, but it is one of the sort of systems thinking protocols associated with risk reduction of Alzheimer's. But the really key thing and David Furman is one of the key longevity researchers at the Buck Institute. The Buck Institute is the largest privately funded medical institution solely put over to really longevity research. David Furman is one of the key players, and this is a stellar cast of longevity researchers around the world. Here's the beauty, I think, of what he's trying to say with this paper, really from this systems thinking perspective, is that, isn't it interesting that all chronic diseases, actually, when you look at them from a point of view of the underlying mechanisms, they're all very similar. And this is absolutely the case. And this is why being a systems thinker is so important. Because let me give you an example. Let's assume, which I've had before, I have the 50-year-old executive coming into my office. He's type 2 diabetic, he's obese, and he has gum disease. Now, in modern world, there are 3 different diseases that you would treat separately. In my world, they are 3, they're not even really diseases. They are the product of gene, environment, and underlying mechanisms that are driving them. So my point about this is that because the mechanisms and the genetics with regards to most chronic diseases are very similar, if you start treating understanding the genes and start treating some of the underlying mechanisms, not only do you start to treat one disease, you start to treat all diseases. So when this guy comes into me, the fact that I can start treating or help him or send him off to an appropriate dentist to start to get on top of the gum disease, I know that is going to have a very significant carryover with reducing his blood sugar levels and reducing his obesity. And if I flip that the other way around, if I start to work on the type 2 diabetes, then I also start to have a positive influence on the oral disease. And I just want to give you some figures on that, just from the point of view of type 2 diabetes and periodontal disease, because those diseases are almost the same diseases. And what we know in the literature is that 80% of people with type 2 diabetes have periodontal disease. They are diseases that run along with each other. They're not separate at all. They may have slightly different skews to them, but they are fundamentally the same diseases. So what I love about this is that what you're doing here is treating or preventing one disease to treat or prevent another disease. And I think that's really important thing to always think about. I want to bring you and just give you some risk factors here, because most of these diseases also have bidirectional relationships. Now, I want to take you to just some of them because I think they're very, the numbers are outstanding. So again, if you're obese, you're 3 times more likely to have periodontal disease. And if you are a child and you are obese, you are 5 times more likely to have oral disease, gum disease. Now, the problem with that is that the gum disease isn't causing the obesity. The obesity is causing the gum disease because of all the pro-inflammatory cytokines that start to get developed when you start getting overweight. Because as you know, a fat cell becomes very angry and starts to tell the body that it's angry and starts circulating more and more pro-inflammatory cytokines. It upregulates the immune system, and that starts to become a problem. And so what happens with many of these diseases, particularly with oral disease, is we get into this catch-22. If you have gum disease, it accelerates other diseases. If you have type 2 diabetes, obesity, if you have rheumatoid, you get this sort of catch-22, which each of these diseases are driving each other, because the mechanisms behind all of these diseases are exactly the same. So again, what I want you to think about here and take it back to where we were with regards to athletes is that you have a duty to be able to think about the longevity and health of your athletes. And so we've got to think better than just giving them certain drinks. For example, we may need to think about the consequences, at least think about the consequences, or try and think about strategies that can go around their training that is not only about getting to them to create optimal performance, but it's getting them to think about risk reduction of a disease that is localized to the mouth. Of course, localized to the mouth, but has systemic effects. Now, again, I just want to give you some numbers just to let you know. And this is, again, sports people in general are going to have a higher proportion of oral disease. But let me just give you some numbers. 2020 paper. And look, isn't it interesting that in higher income countries, you're going to see more periodontal disease than in lower income countries? I wonder why that is. But the point about that is that oral disease is not a disease you're occasionally going to see. And this is one of the mechanisms why I thought I needed to develop a genetics panel, because based on the numbers, there is probably, based on your population group, mine's generally over 50 who come in to see me, we are almost looking at maybe 1, if not 2 out of 3 patients who come in to see me probably have established periodontal disease. And that periodontal disease is probably having other effects on other diseases. So they may be coming in to be treated for something completely unrelated, like type 2 diabetes, like rheumatoid arthritis, like cognitive decline. But I can guarantee you that the oral disease will be associated with their increased risk. And again, I take you back, is that you cannot wait till they're in their 40s and 50s to treat. You have to start putting mechanisms and processes into play now, and that becomes even more important if you're dealing with athletes. Now, I'm going to just, as you say, what I want to do is just fine tune this for Alzheimer's disease. I appreciate this is a sports nutrition lecture, but the key for here is that what I'm trying to say to you is that if you don't think about this with your athletes early on, and your athletes may have susceptible genotypes, then you may be sort of accelerating the process to diseases that they may not want to have in years to come. Now, I just want to give you an example on this because this is a systemic review over 2 decades, 2021 paper. And what we know is that periodontal disease is highly associated with Alzheimer's disease and its development. And so finding a treatment strategy to reduce periodontal disease could be a way to explore Alzheimer's disease prevention, especially in athletes, because as we know, athletes are likely more susceptible to early onset oral disease because, and again, this is what I want to get your thinking caps on tonight, there are mechanisms associated around their sport, around their dietary inputs that may cause problems here. And again, just a really classic paper, look at the title of this one, and this is from 2012. Periodontitis and diabetes, a two-way relationship. And the reality of that is that these mechanisms, these two, what we think is separate diseases, aren't separate at all. They are almost the same diseases. So if in the future you ever have to deal with someone with type 2 diabetes, you absolutely need to be asking them, what is it what is the state of their oral health? And again, if you've got an athlete who has a family history of diabetes, then that's a really important thing for you to maybe ask your athletes when they don't even start to show any signs of these diseases, because it might be telling you that you may have an athlete who's super fit at the moment, but has a genotype that is more associated with diabetes. And again, this is a really wonderful paper. This is 2017 paper. And the importance of this paper, just look at the title here. High-risk periodontal pathogens contribute to the pathogenesis of atherosclerosis. What is this paper trying to tell us? What this paper is trying to tell us, and these are the researchers at Vanderbilt and Texas Tech in the US, is that a particular pathogenic oral bacteria contributes to the development of the plugging up of your arteries, and it is a causal mechanism, not an associated mechanism. And that's quite a profound statement. And how the hell does that happen? So what I'm going to do is I'm going to briefly go through some of the mechanisms that, certainly particularly as a systems thinker, I always have to think about in practice, that are really giving you an understanding of how a local disease, periodontal disease, can cause systemic problems, particularly with your athletes. So here's some concepts, and these are the concepts that underpin the DNA Smile training that I developed. I'm really keen to not just give you a genetics panel. I want to give you the systems thinking concepts that go behind this. Again, all related back to, it's maybe a good idea that I understand not only what my patient is doing as far as foods, understand their training more, and understand that from a point of view of the oral health. It takes us back to understanding that humans are a superorganism. We are a whole sort of group of human cells, but importantly, slightly more bacterial cells. And that's really important, because what that means is that you've probably got to think of your athlete, and I've certainly got to think of my patients from a point of view of maybe the first question I should be asking when they come in here and they've been treated by everyone else and they're not getting anywhere. Maybe I should actually ask, well, how healthy is your bacteria? Given that you're more bacteria than human cells, maybe we've got to think about our athletes like that. And maybe certainly I have to think about my patients that way. Because that's the sort of first concept that I think we really do have to start adopting. And that is that given that we are more bacteria than human, doesn't it make sense that we investigate with our athletes or with our patients who are particularly unwell, the systemic bacterial health? And of course, that would be important given that we'd be exploring the mouth. The reason why that's important for me is the mouth is the real first major sort of contact that we have with the outside world. And it is the second most dominant microbial community outside of the large intestine. So it's a big player, and you want to make sure it's as healthy as possible. Now, not only do we want to know what's happening in the mouth, how we can create good health in the mouth, what we also need to understand, and this was part of the constructing of DNA Smile, is that how our immune system sits in our mouth, and it's trying to tag defenders, particularly pathogenic bacteria that will come in through our food or wherever else it comes through from. Because oral disease is a combination of two very simple things. It's a combination of who's on the battlefield and what is their pathogenicity. And then it's also about how our immune system is going to respond. Now, what we've always got to accept is that when our immune system responds, sometimes, well, all of the time, you're going to have some degree of structural damage around where it's attacking bacteria. And of course, that immune response can damage structures and borders that really protect us from the outside world. So part and parcel of the development of DNA Smile, that is not only for general public, but for athletes, is that we've got to have an understanding of how we may defend against the outside world on an individual basis, because the whole point about the personalized side is that no one is going to ever adapt or defend against the outside world the same as anyone else. It's completely unique. And this is the part of, again, is making sure that we're trying to do with Ian's courses, is to understand that although we might have an individual or two individuals who have the same problem, the way we treat them is going to be completely unique, because they're going to be unique to you. And so what does that do? When we start to have compromised borders, and this might be erosion of gums that may come from implements that we put in our mouth that protect us when we're playing sports, or it could be that we've got some kind of gum recession, or of course we've got some more, if you like, if we're starting to develop periodontal pockets, we are creating compromised borders that increase our risk for systemic disease. What do I mean by that? Well, humans protect ourselves from the outside world by having really good borders. And those borders, the job on those borders is to allow things to come in that they want, but other things that they don't want not to come in. So we've got to have good borders. We've got to have good structures. When we start to get compromised, the borders get leaky, and that allows for molecules, it allows for pathogens to translocate from a local position in the mouth to a systemic position. And I want to take you back to the paper that was the Texas Tech paper looking at a periodontal pathogen being one of the causal mechanisms in atherosclerotic development. And it's been a causal mechanism because it's sitting and getting through compromised borders, maybe even when your gums are bleeding. That would be a good example, where bacteria have this capacity to jump ship into the systemic system, and they can end up anywhere. And I'm going to show you some examples of where they could end up. It could be in the circulation, it could be on the arteries, it could be on the joint surfaces, and particularly it could be in the brain. And the point about that is that these borders, now again, probably the dominant border you always hear about is leaky gut. But when we're looking at the gut barrier, when we're looking at the oral barrier, when we're looking at the skin barrier, and importantly, the blood-brain barrier, these barriers are, although they are very similar, and I try to use the analogy of, imagine they're all castles, but they're all different castles. That will give you a good analogy, because all these castles do a similar job and they look similar. So therefore, if one of your barriers is breached in the mouth, for example, or in the gut, the chances of other barriers being breached are much higher. And there's lots of literature in this. So this got me to develop my little poem, which is, if you've got leaky gums and leaky veins, leaky guts and leaky brains. And this, I will guarantee you, I see time and time and time again with patients, particularly with the long COVID patients that we dealt with. They've got compromised gut barriers, they've got compromised oral barriers, and we see compromised blood-brain barriers because of that. And as I'm going to show you, when bacteria start translocating from one place to another, they start to cause longer-term systemic health outcomes, which is taking you right back to, again, what I was saying about this, for me, is part and parcel of truly preventative sports nutrition. I want to give you a very quick example before we move on. This is an example of a patient. I'm going to take you through this one as a study case, just to give you an example. So this was a 56-year-old female who came to see us. This is several years ago now. She was diagnosed with moderate to severe rheumatoid arthritis. And she'd actually been under a functional medicine clinician for over a year, actually. And to be fair, they'd done a pretty good workup with her. But after the year of her, and she's the most compliant patient you'll ever see, spending a lot of money, a lot of changes to diet, etc., a load of supplementation. Her basic markers, her inflammatory markers were getting no better. Her disease markers were getting no better. In fact, they were actually getting worse. So by the time she came to me, and after doing my due diligence on this patient, this came up with the key thing and the key question. And this is a question that you probably really do need to think about, is that the only question that wasn't asked was, what is the state of your oral health? And of course, this is a patient with very significant oral disease. And so for me, that was the canary in the mine for this patient. And knowing that, and knowing that she'd been treated by actually a pretty good clinician for over a year, there had to be something else that we needed to look at. And this was a huge red flag for, we need to do a lot of work around her oral health, because I believed that it was oral health and the mechanisms being driven from those oral health that were causing the rheumatoid disease process. And so the first thing we did is that we went to, I got her to go to see one of the dentists that I trust, and again, a systems thinking dentist, so that I could explain to the dentist what I was doing, what I needed to be done. And to be fair with this patient, again, she's incredibly compliant, which is great, where we got Victoria to do her treatment, which was really quite an intensive strategy because she had very severe periodontal disease. So we needed to get on top of the periodontal disease. I take you back to David Furman's paper that we talked about, because I knew if we got onto the periodontal disease, that was going to allow us to get on top, potentially, of the rheumatoid arthritis. Now, we did some pretty amazing stuff on this, as you can see on here, on this picture, on the right-hand side. We used some really great novel testing here. We were using oral pathogen testing. We were using my new DNA Smile. So we had the oral genetics with the mouth. And of course, a lot of the oral genomics, when we see their single nucleotide polymorphisms on that side, really have strong associations with upregulated immune system. And in one of them in particular, IL-17A, which has a huge relationship with regards to autoimmune risk. And of course, rheumatoid arthritis is an autoimmune risk. And so the beauty of this, we created a sort of double-pronged approach from this. I worked on the systemic effects while Victoria worked on the localized effect. And within 16 weeks, we took this patient from severe rheumatoid arthritis with polypharmacy to pretty much being in remission. And so what we were able to do here is show the example of, and again, as you can see, the title of periodontal disease and rheumatoid arthritis, killing two birds with one stone. And what I'm trying to show you here again is that how I didn't approach this from a point of view of just dealing with a classical rheumatoid approach. I dealt this from a point of view of there is a local disease that I believe was causing systemic downstream effects. And by putting her on this strategy with good systems thinking, with novel testing, we were able to pretty much put her in remission within, as you say, 3 or 4 months. So completely life-changing. It showed great systems thinking approach. Obviously, we presented this at quite a big international conference, 2021, I think, a couple of years back. But what I'm going to show is the power of understanding the importance of what's going on the mouth, in and on the mouth, and the importance of actually just allowing your patient, your sports people to be aware of this, because most people aren't aware of these relationships. And to be fair, a lot of the dental world aren't aware of these relationships. So it's not just going to be sports performance, it's going to be the whole dental industry as well. I just want to bring that back into how we have a local disease affecting systemic disease. Obviously, I have a speciality in understanding cognitive decline, and I just want to give you that. I want to give you that feel of how, if we don't start thinking about oral health, it can have a systemic effect and sort of be highly associated with Alzheimer's disease. I'm going to show you that. And because again, this lecture is really about really sort of getting you to think about potential risk factors as a sports performer and how that has potential consequences as we age. So Alzheimer's research is consistently changing. It's becoming much more multifaceted, but here's what I want you to think about, is that Alzheimer's is now being seen as, again, there's many influences, it's multifaceted, but Alzheimer's is seen very much in certain individuals as an infectious disease. And this is a 2016 paper. And look at what we're saying here is that we have to consider Alzheimer's as an infectious disease. And this is the first and most important consideration. So might be new to you all, certainly not new to me, but this evidence has been around for quite a long time. Now, a very recent paper, 2022 paper, looking at Alzheimer's disease as a potential infectious agent. Really good paper, this one. Again, remember, all free access. And I'm bringing the diagram in because lo and behold, what we see from the diagram is that some of the pathogenic bacteria, oral pathogenic bacteria, are highly associated with an infectious process in the brain. Now, I want to show you that even more because, as I say, this is quite a specialized area for me. I know quite a bit about it. But my point about this, how the hell is an oral bacteria getting in the brain? So hopefully you've had some degree of understanding of some of the basic concepts that if you're starting to have bleeding gums, trauma to the mouth, gum recession, alteration in the microbiome, and various aspects of sports performance and their training that may accelerate this, then you've got to think about, wow, am I accelerating risk of sort of some of my patients, sort of accelerating the risk of some of these chronic diseases, and in particular, maybe Alzheimer's? The answer to that is absolutely yes. And let me show you some more details on that. So again, here is that oral pathogen we're talking about, Porphyromonas gingivalis. Okay, so again, another major systemic review. And this is something that I test for consistently with patients. What I want to show you with the effect of certainly oral pathogens is they have a systemic effect on the body, from increased risk of cancer, increased risk of cardiovascular health, increased risk of joint and musculoskeletal health, increased risk of dementia and brain health, metabolic health, and adverse health pregnancies. So there's nothing that it doesn't seem to have a relationship, but hopefully what I've touched on is some of the concepts of why these bacteria have the capacity to translocate, and that comes down to good or bad oral health. So I bring you back to that situation. You must be asking those questions about your patients, and you must be thinking about the oral aspects of the activity they're doing, the foods they're eating, the temperature control, the psychosocial stresses. They are all influencing that picture. So look, let's look at this. Here's a 2020 paper. Really great systems thinking paper, this one. But look at that. Look at the title. Porphyromonas gingivalis is a strong risk factor for Alzheimer's disease. And are we making this worse by giving our patients or our athletes maybe inappropriate drinks, not thinking about the hydration status, maybe not thinking so much about maybe their gum shields and what are the consequences of those? I think the answer is we need to start, because these are the mechanisms, not yet, but we will start to see this sort of thinking that we're talking about will start to appear in the literature, I guarantee you, in 10 or 15 years. So it's important that we start thinking about it now because the evidence is there. This is what I think is really important. I think is really clever about what was written on that paper. So periodontitis is an early disease, generally develops in our 30s, predominantly 40s, but it develops quickly, as in it's an earlier disease. What we know about Alzheimer's is what we call LOAD, late onset Alzheimer's disease. And it really, although the evidence is changing, we're starting to see people, much more of the population developing Alzheimer's in their 50s. It's generally a late onset disease. But what I love about this is that if we start understanding the health of the mouth, we're starting to maybe develop this window of opportunity where we're offsetting our athletes' risk of sort of these chronic diseases at later life. Because what we know is that it's a lag phase between these early onset disease and periodontal disease for some. I mean, we've had patients in their 20s. It's highly unusual, but we definitely have patients in our 30s and our 40s and definitely in our 50s. And in fact, by the time people get to 50, 50% of the population will have some kind of periodontal disease, whether they know it or not. But what this paper is saying is that, you know, there's a lag time in decades between these diseases. And so wouldn't it be great if that we can sort of try and do something in that lag time? Because what we're trying to do here is save our patients to essentially have decades of potential toxic insults from some of the proteins and proteases that Porphyromonas gingivalis in particular can have within the brain. And let's just think about this again. The concept is, number one, when your blood-brain barrier is compromised, things get in there that shouldn't get in there. Now, your brain's immune system has to respond to invaders, and it does that by inflammation, oxidative stress, and increased immune activation. And of course, that damages the brain. It creates neuroinflammation, and that's one of the mechanisms that drives cognitive decline and Alzheimer's. And they are also the mechanisms that drive cardiovascular disease, rheumatoid arthritis, type 2 diabetes. So what I'm trying to give you is this picture that think about oral disease, think about the mechanisms in your sportsmen, because they are more at risk potentially by some of the practices they use. And I want you to quiz me on that and have a think about that, because you are saving potential issues in later life. And this is about as good a preventative medicine thinking that you can get, I believe. And that's the whole point about what Ian is trying to create with his institute. It's about the health of the athlete. It's about the longevity of the athlete, but the person who is the athlete after they've been an athlete. It's really, really important to think about from that. I'm going to pretty much stop on that, Ian, because I don't really want to rack into DNA Smile, because I think it might be a good time to go to questions. Because really what I just wanted to try and achieve on that is just show you that some of the unforeseen consequences that we may not think about may be part of the consequences within the bigger picture decades in front of us. And we want to have a deeper understanding of that. We want to have a deeper understanding of maybe the way we want to think with regards to, you know, diseases that may be developing. And remember, chronic disease just doesn't turn up. It's not, I'm good this day, I'm bad the next day. Chronic diseases take decades to get to this point. And so you have an opportunity to do great preventative medicine with your sports people, your athletes, your weekend warriors.
Okay, I've got two questions. If the rest of you can get speed typing and let me know what you'd like to ask Pete, then we'll get into a discussion. So Paul was asking, was there any research done on COVID and long COVID patients with oral inflammation?
A good question. Not that I'm aware of. But I think the patients that we've had with long COVID, there's a whole discussion about whether actually we've still got some patients who still have the active virus. We think it might hide out in a GI tract, but we're not sure. The patients that I've seen, most of them have neuroinflammation. So they have terrible brain fog. That's part and parcel of it. And obviously they've got dysfunctional mitochondria. So their power plants are poor. But within all of these, certainly the ones that we've tested, which we've done 3 where we've done leaky gut, leaky brain. So we tested for antibodies against leaky gut. We tested for antibodies against leaky brain. And both of those have shown us that. So I know it's a small population group, but it fits the picture with regards to what happens when you have compromised barriers. Because remember, when those barriers are compromised, whether it's the mouth, whether it's the gut, whether it's the brain, it means that not just oral pathogens can get in, but every other Tom, Dick and Harry pathogen can get in as well. And so one of the key mechanisms for me with regards to getting people better is make sure that we have an understanding about whether barriers are compromised. And if they are compromised, we need to do something about that. So again, I bring you back to your sports, your athletes. You know, if we've had, you know, in particular, I mean, it's very unusual, very, very unusual to see periodontal disease in anyone under 30. But if I'm consistently having trauma to my mouth and my gums are bleeding, etc., I've got ill-fitting mouthpieces, then that's problematic, because that could start to create gum erosion. It can also start to create gums that bleed, and that allows pathways for bacteria to translocate.
Sarah in New Zealand, who's a specialist in this area, she says one of the risk factors for poor outcomes from COVID-19 is poor metabolic health. So yeah, all ties into what you said there. Paul's asking, what's your opinion of commercial toothpaste and washes? There's obviously your commercials, and you've got your health-friendly ones and eco-friendly ones. What's your thoughts?
Well, look, I think the reason why the mouth is a problem is because it has teeth, and actually the sort of the surface of the mouth actually is quite a bit thicker than the sort of GI tract, and so it's sort of protected from that. But then you've got these bloody big turrets that stick out from it, and unfortunately, it's a beautiful surface to have adhesion of bacteria, and so that's where it becomes problematic. And so, you know, this is why cleaning your teeth is so important. And so what I would say on that is it's a balance. If you're not cleaning your teeth and not using good dental hygiene, then that's massively problematic, regardless of what toothpaste you're using. So you must have good dental health. You must, if you can, be going to, I would say, more to the dental hygienist than the dentist, maybe once a year, twice a year, particularly as you get older, in my opinion. So being in a good dental regime on a daily basis, I think, is super important. But there is some evidence to show that, of course, we're looking at you want a toothpaste that is generally, if you can, supportive of the microbiome in the mouth. And many aren't. And certainly many toothpastes have been proven to contain a chemical called chlorhexidine. And what we know on chlorhexidine, it wipes out the bacteria that sit on the back of the tongue. Very important, this for sports performance. And those bacterial groups at the back of the tongue actually sort of are important from taking nitrates out of food and helping them to convert them, start the process of converting them into nitrate and then into nitric oxide. And of course, as you know, that's really quite important for athletes, particularly around beetroots, etc. That's sort of those beets and foods that stimulate nitric oxides, give you better blood flow, better sports performance. So we're clear on that. We're clear that that might be problematic. But Ian, it really depends. I mean, again, what I would say on that, you know, if you've had some kind of quite serious dental surgery, then you really do need to hit yourself with either antibiotics or the real big antimicrobial, antiseptic mouthwash for a period of time. But if you're utilizing that every day, then that might be problematic. And of course, what we know on chlorhexidine, because it interferes with the bacteria, it potentially interferes with high blood. It creates an environment where you may start to develop high blood pressure.
Thanks, Pete. So I'm hearing the word balance again, and I think that's good advice based on your oral health. How aggressively you try and keep the hygiene. Sarah's adding in, there's plenty of evidence that we have a range of bacteria in our mouth, but the overproliferation of bacteria that are associated with decay and periodontal disease are the problem. A bit like that, you can keep all sorts of cats as pets, but you would need some special controls on a pet tiger, like a cage, because it gets out of control.
Yeah. So okay. if I can reiterate on that, we think we've got over 2,000 in it's the second most dominant microbial space behind the large intestine and colon. So and this is one of the reasons why, again, there are some major risk pathogens that we know and have been identified with. So we've done a lot of periodontal testing with patients over quite long periods of time, and these are just some of them. So these are, if you like, the high risk, moderate risk, and low risk pathogens. And as I said to you, so what we don't want to have is patients where, well, we really don't want to see too many of the red high risk pathogens. And this lab actually does a really good job, because these black bars are telling us really sort of where we'd expect to see levels with regards to moderate to well-developed periodontal disease. And of course, not only that, is that what we're also looking to try and understand, as I said to you, it's a whole microbial community. You're trying to keep it happy. All these bacteria and phylums do different jobs. But if you like, you're looking here particularly at the special forces. So these are likely to cause problems, not only locally, but systemically if they translocate. The whole point about me doing DNA Smile is that it's not just a question of having a mouthful of bacteria that are likely to be pathogenic. It's also about how that immune system is going to respond. And so that's the key thing, because we've had people where what we've done is understood much better about some of the localized immune gene variations, that both local and systemically, and we've controlled for that over time. And that means that actually we've tried to do a systemic approach from a point of view of control the mechanism systemically, but also locally. And when you get to do that, you can have patients that have higher pathogenic load, but they've got an immune system that is less responsive. So it's not just a question of, it's a very nuanced situation from a point of view of, again, it's a little bit like you can have people who certainly GI tract are having more and more problems with foods that they shouldn't, that maybe are potentially, what's the word I'm looking for, more allergenic in nature. And they're responding more and more to those foods, because maybe the microbiome and the way the immune system is currently in the gut and sampling things is maybe not in great shape. So it's a little bit like the gluten argument, is that we know that gluten as a molecule is highly developed, big structural, lots and lots of proteins. It pretty much damages, it certainly causes problems at the gut in everyone. But that doesn't mean to say that everyone is going to have problems with gluten, and we know that. But so that's why, again, this is sort of a similar nuanced version of that. And again, it's why it's so important to get some understanding about how an individual, from a point of view of almost unique genetic signature, may respond or over respond to the pathogenicity of some of the bacteria. Ian, can I just sort of throw some things out for people to think about that is appropriate to oral health and sports performance, because I think that might be quite important.
Yeah, so, can I just ask you, Pete, can you share which labs you use for the oral microbiome?
So I think in the UK, so this is an American lab. This is oral DNA labs in the US. I prefer this test. I think it's simpler. I think it's more easily explainable to the patients. The other lab is In Vivo Labs, which is UK lab that you can use. Again, does very similar testing. It's just a little bit, I prefer the oral DNA labs because I like pictures. It's easier to explain to patients. And of course, this is DNA Smile. You can get that from Nordic Labs.
Can I ask a question for Tracy? Should we be advising against sugar-loaded products?
So I think this is the interesting thing, isn't it? Is that, you know, there are always compromises in sport. And, you know, I think some of the way we, you know, I think about the Tour de France and the way they're sucking gels all the time. I think it's a question of what's best for the athlete from a point of view of performance. And this is where performance and health sort of sometimes don't mix. My question about that is that if they are going to do that with high sugary foods, which many athletes need to do, what do we need to think about? So how does that sugary food maybe change the pH of the saliva? And how does that change the microbial environment? We also, again, I was going to go into other stuff on that, but I think the answer is on that is that that doesn't mean to say you need to stop or change, because carbs are king at top end. That's for me. And so, you know, you need to be fueling those carbs, and you, not only beforehand, but also for a lot of, particularly in the endurance side, whilst you're training. And so I think it's a question of, if I'm going to have to give them highly refined sugars through the training, what is it that I need to do or think about after that? And what is it from a point of view of the consequences of those sugary foods? What do they do? If I'm going to be doing that all the time, how is that changing that microbial environment? What is it doing from a point of view? Is it reducing the pH? Generally, the pH is quite alkaline in the mouth. But of course, obviously, the key things about sugars is they reduce the pH down and also change the bacteria because eventually, so that the bacteria become more acidic. And of course, that increases your risk of you know, cavities. So these are all things that we probably need to think about from a point of view of sugary foods. I don't think you can get away from it, but I think I bring you back to, here's another reason why you think, shit, I really do need to maybe just simply pay attention to good dental health, because maybe I am more at risk than the general population to having problems. And I think the answer to that is yes.
So a performance athlete might need to start thinking about, well, yeah, I'm going to use these very sugary products in a performance context, but shy away from using them in a regular training context. And you know what I teach on my courses is alternatives. You can make DIY sports drinks out of fruit juices or honey flavored ice green teas and rooibos teas and things. So you can be a bit creative to decrease the straight sugar load.
I think we've got to think about, you know, other aspects of this. You know, we've got to think about stuff like climatic conditions. You know, what happens in warmer weather where I'm getting more dehydrated? I've got a reduced saliva flow. I mean, saliva is an incredible fluid that has a huge amount of protective proteins in there. And so, you know, am I accelerating potential problems in the mouth if I'm training in warm climates all the time, if I've got reduced salivary flow? And let's face it, we all have reduced salivary flow when we're training hard. So is that going to be a consequence? And is this conversation we're having now what we're going to be seeing in the literature in 10 and 15 years? Is that where we're going to go? The other thing about that, you know, again, even before I, you know, a couple of minutes before I came on, I have reduced salivary flow in my mouth because there's a little bit of, regardless of how often I've spoken, there's a little bit of stress response. And so one of the classic stress responses that you always see, particularly when people get up to speak, they've always got a glass of water with them. Now, why is that? It's because salivary flow rates drop right down. And of course, that has consequences for the health of the mouth. Now, again, this is where I think you've got to think about training load, training intensity and frequency. How many hours a week am I potentially going to be in conditions that may be suboptimal for oral health? And if you add on top of that environmental conditions psychosocial stresses, climatic impacts, you can get this understanding that, hey, you know what, this maybe isn't great for that oral situation. And maybe this is where I've got to think more sort of 360 about some of the consequences of that. So I hope that sort of makes sense.
Yeah, that makes me think of Paul Loren's ecosystem theory by looking at the whole aspect of the athlete's life. Pete, you wanted to take us onto some other discussion?
Well, one of the other things, again, I think one of the other aspects, and I think, you know, the 20 Dentistry Journal I'm showing there, it's a really good read. I think it's a nice place to start. But one of the other things we should be thinking about is implements that we put in our mouth, particularly gum shields, because ill-fitting gum shields are notorious for causing problems. So again, something to think about from a point of view of sort of almost like mechanical erosion. Dental trauma, really important again. So think about the sports where maybe dental trauma becomes an issue. But again, if you were like me, who was a rugby player throughout sort of college and university, I mean, God knows where I ended up putting my mouthpiece. You think about the sort of things we might need to think about, or the way we look after our mouthpieces, rather than sitting in and just leaving them collect God knows what on them, and then just putting them back into your mouth. So lots of evidence with regards to dental wear, with regards to gum shields, really important, and definitely something to think about on that. But also think about maybe some particular activities where there may be almost like an aesthetic issue with. So there's lots of evidence to show that swimmers in particular, because they're swimming in pools that have a lot of chemicals in there, can get very severe dental discoloration, erosion, which is something, again, it's quite new to me. So again, that is something we need to think about, you know, and is it a way that we can protect swimmers? Because if they're going to be, you know, doing very significant hours in the pool, which most of them do, I mean, very significant, then what is the effect of having, you know, being in a fluid where there are quite harsh chemicals? So you've got to think about that classic dental erosion. You've got to think about that dental discoloration. You might need to think about, you know, just the sort of psychosocial aspects of maybe the sort of the trauma that might cause an athlete from a point of view of that. So there's lots and lots to think about in this area with regards to, I didn't even think about that. So I think about dirty gum shields, ill-fitting gum shields. I also think about swimmers from a point of view of what the hell is going to be in the pool. And because let's face it, if we've all swum, we've all taken a bit in occasionally. And so, you know, swimmers in particular are going to take much more in than a normal situation. But of course, again, what we've also got to think about is from training, you know, classic stuff, which is sort of classic sports science, you know, reduce secretory IgA levels, because we reduce salivary flow rates. And what does that do? Well, of course, it increases our risk for upper respiratory tract infections. And is there any way that maybe we can help our athletes on a general basis from that perspective? And maybe there is. Maybe there is something that we can put back in the mouth that is going to be helpful on that side. My first protocol is to just give your athletes an understanding that actually cleaning your teeth well is really important for their longevity. So that would be my number one, regardless of what they're cleaning their teeth with. You can start to think about, you know, the importance of dentist appointments, but the importance of dental therapist appointments. So that physical removal of any plaque buildup, I think, is going to be really important. So just basic dental advice on that side. Again, you know, what would be simple? Well, again, we talked about potential issues around toothpaste, but I'm more concerned that you've done the first step and patients are just really cleaning their teeth well. There is no doubt that TPs do really good jobs. So the interdental brushes. And again, I think electric toothbrushes are brilliant. And again, if you are, I think me and you have done this both, Ian, through our career. We've been overly aggressive with the way we brush our teeth. And of course, that's another mechanism that drives gum erosion. And that's another mechanism that may be opening up your patients to more risk. And then again, we can talk about this sort of, you know, the dietary lifestyle. Again, this comes back to good sports nutrition, about trying to work people through good colors, anti-inflammatory diet lifestyle. And then if you want to go down that route, you can start to get into some of the very sophisticated toothpastes. This is an American company that uses a really pure toothpaste, no fillers in it, no fluoride, no SLS. And actually, this one is really good for really breaking down bacterial biofilms. I've had lots of good results with this, but it's super expensive. So again, I think start with the fundamental basics. And really remember, this is only for when you start getting the olds who can afford it and they've got advanced periodontal disease. And that is something that you might want to choose from that perspective. And you can certainly, there's loads out there. And again, there's another in vivo, a UK company that have strain specific bacteria that are designed to try and help the microbiome within the mouth. Again, you can use those. We give these advice to our patients frequently. Remember, our patients are older. So, and again, remember that generally over 50, more than 50% of the population are going to have periodontal disease. So it's really much more valid for them than it is now. But again, it's the question is, but it's got to taken them 2-3 decades to get to that point. And so we might be in a situation where susceptible athletes may be accelerating this point so that they're actually getting and developing periodontal disease much earlier. So there are many ways, even you can get chewing gum that has xylitol and sorbitol in, actually really good for helping the microbiome. So, and shown to inhibit bacteria, which are associated with periodontal disease. So there's lots of things out there. I talked about chlorhexidine. I mean, we're even doing genomic SNPs with regards to some of the genes associated with poor nitric oxide production, as an example of one there down the bottom. So this is where we're really personalizing our understanding to say, hey, you really need to think about, if you're using chlorhexidine, that might be problematic, because we've looked at some of the gene variants that are more associated with maybe problems around enos, which, this is an example from there. Again, just an example of the other lab that we use sometimes, again, showing, some of these high-risk red complex pathogens that really we do try and need to get these levels down. What I want to be clear about on this is that these connections are only just starting to be noted. So, and the evidence is there, but I think it's going to be a while before we start doing specific thought processes and specific research on athletes and their risk of periodontal disease, and then that periodontal risk exaggerating and systemic disease. But for me, the evidence is already there. I mean, we're working on this, day in, day out in practice. And so, what I don't want to have is that, you're going to have certain athletes who do certain processes who made you more genetically susceptible, where gum disease starts to become more prevalent much earlier on. And they're the sort of canary in the minefields where we go, this is maybe genetically driven, or a component is genetic, and it's been exaggerated by the sporting endeavor that you're in and everything that you have to do around it. And so you want to catch those canaries, because the development potential and the potential risk development of other chronic diseases just jumps up. And so if you can avoid it, you really do need to try and do something about it. But again, it brings us back. There's a very simple sort of closing statement on this, Ian, is that most people just don't spend enough time on a daily basis just doing the basics well. And that is 2 minutes with an electric toothbrush, replace it every 3 months, would be a great start. Maybe use TPs if you've got gaps in your teeth, because we know about 30% of plaque exists within there, and it's very difficult for brushes to get into. But again, you maybe start to have these biofilms that get formed, and then, it's very difficult to get rid of without physical removal. That's why you've got to go to a hygienist to have it scraped off. And so we want to try and reduce these very really incredibly sort of, what's the word I'm looking for? That these biofilms, the plaque that gets developed is really robust. They build these beautiful houses and invite all their other bacterial friends, and they're difficult to get rid of. So you don't want to make that situation more sort of party time for these potential pathogenic bacteria. So clean your teeth really well, particularly if you're an athlete. Think about the products that you put in your mouth. You know, if it's an ill-fitting mouthpiece, it's usually a cheap one that we usually get. You know, you'll get a cheap mouthpiece. You'll do it where you do it at home. Ill fits can cause problems in the mouth. There's definitely evidence that they're not great. And, you know, if you can, then you want a custom fitted. But then a lot of these custom fitted now can get custom fitted with a lot of antibacterial products in there. So that allows the sort of risk reduction, of course, of potential pathogenic bacteria on that side as well.
Thank you, Pete.
All right,
I really
pleasure.
appreciate it.
Thank you so much, everyone.